Hi, everyone. It is Deanna with Premier Behavioral Health Services, and I am joined by Dr. Ryan Mekota, who is a clinical neuropsychologist as well as director of dual diagnosis services for Premier. Hi, Dr. Mekota. How are you?
I'm doing well. How are you, Deanna?
Good. So I wanted to ask you today, obviously in light of the current events, we have oftentimes made jokes and tried to downplay a lot of the drinking or substance use that has been going on, 2 p.m. wine with DeWine and these power hours we're seeing on Zoom.
Sure.
But in all seriousness, the question that we have for you today is how does someone know when that substance use is requiring, enough for them to see a mental health professional?
Sure. Yeah, and I think we all get it. We have senses of humor too in the mental health field, and these times we can do with a little levity. And but I think it's important to acknowledge when, okay, maybe it's not just extra beer here or there, but becoming more of an issue. And yeah, there are some things that we should keep an eye out for. I think one of the big things is anyone else in your life mentioned anything to you? As your wife or girlfriend or mom or whoever expressed some concern, that they hadn't in the past, and they're wondering, hey, this is really picking up here, because a lot of times we don't even notice. We won't really kind of realize, or we won't really be paying attention when 3 beers turns into 6 or whatever it is. Another sign I think it's good to keep an eye out for is, are we thinking more about it? Whatever the substance is, if it's alcohol, if it's marijuana, or one of the more illicit or illegal drugs, do you find that part of your day it's coming into your mind if you don't have it, and then you're thinking about or counting down, like, man, when can I stop, close the laptop for the day so I can have a few glasses of wine? If that becomes more of a target of our thoughts, then it's another indication, maybe, hey, let's at least have someone talk to me about it and see if this is worth further treatment or exploration. And then a third and a big thing is, are we using it to treat something else? If we're honest about it, are we taking a 1 or 2 hitter and to try and sleep, or are we having a couple of beers because we're more anxious than we used to? If we're using any given substance to try and quell some kind of feeling or improve some kind of feeling, that can be an indication that it might be time to seek help. And of course, no one uses psychoactive substances or alcohol or drugs to feel worse anyway, especially even alcohol. But, am I anxious and worrying? So first thing I'm trying to do is get a beer, or things like that we should keep an eye out for.
Excellent. And can you explain to me what treatment for this would look like?
Sure. Well, first things first, because you're coming in and we're thinking, okay, we're not quite sure, is this an issue or is it not? We run through a lot of history with you, get to know you, try and figure out what exactly is going on. Is it something that, in our expertise and based on all the research of everything that's been done with substance use conditions or any problems of that nature, then do they warrant further addressing? Do they warrant further treatment? And we have a range of services and different disciplines within mental health. So we can do individual therapy, and we have different medication management if there's also other issues going on. We also have programs that, maybe a different tier above individual therapy, if we feel like, hey, could use more treatment, a more, support to help get you abstinent, or and manage, the mental health symptoms. We call those programs IOP, and IOP, or intensive outpatient, sounds bigger than it is, but really it's just kind of designed to, hey, let's look at this from a different angle. Let's match the dosage of treatment as far as therapy to the level of symptoms we're experiencing, so that you can feel better, feel good, and get on your way as quick as possible.
Excellent. Now, if somebody is struggling and they are kind of eager to begin, how would someone go about scheduling an appointment to see
Sure.
you or a colleague?
Right. So we're doing everything, remotely. We're all operational. We're all working, all the clinicians that we have, and we're moving. We're ready to roll. So you can always call the front office at 440-266-0770. You can find us online. You know, there are a lot of different ways. You call up and they'll set up an appointment with you, and we'll do it virtually, you know, and you don't have to leave your house. You just find a quiet place, a relatively quiet place you can, and, you know, we'll be good to go, and we'll set it up pretty quickly.
Okay. Well, thank you very much. Truly appreciate your time. And just as Dr. Mekota had mentioned, if you are struggling, please do give us a call. And Dr. Mekota or any of his colleagues would be able to certainly assist. So thank
That's
you
right.
again for your time, and thank you all for watching.